I'm feeling good.
Welcome back. Millions of people in the U.S. suffer from diabetes, and many of them aren't even aware they have the disease. If you're looking for a fresh approach, a way to help lower and stabilize your blood sugar levels, lose weight, and possibly get off all those medications, we have the answer. Dr. John Craig has been treating patients for 25 years in the San Diego area. Good to see you again, sir.
Nice to see you, Craig.
All right, so you treat people all the time who have type 2 diabetes. Many of them don't even know that they have it. What is the typical person that has type 2 diabetes experience?
Greg, what usually happens is a person's losing energy, they start gaining some weight, go to the doctor for a general appointment, and the doctor comes out after a few tests and says, you know what, you've got diabetes. Start to give them a basic exercise program, some medications, and frankly, because it doesn't really approach the underlying cause of the disease, it gets worse. And the next thing you know, as the medications are going up, the next thing you're talking about is insulin. So the general program in America is that we're getting worse and worse.
Okay, so one of our viewers comes to you, wants treatment. What's the initial consultation like?
The initial consultation is really to see if it's a good fit. We don't take every patient. This is not for everyone. It's for individuals who really want to take charge of their lives. So ultimately, the person comes in, we kind of find out what that motivation factor is, because we're really interested in dealing with the underlying cause of the disease, and it allows that person then to take action on it and really change their life.
Take action and possibly get off all those medications, right?
Well, that's where the miracle happens. What happens is we focus on the biochemical, hormonal, physiological aspects, and when we do that, we really get to the underlying cause, and as a result, literally in a good percentage of our cases, we get them off all of their medications.
And they felt like they haven't felt in years. And, you know, is there a common thread that you see with your patients?
One of the things that happens is, again, when they're diagnosed with the disease and the medications are going up, that common thread is that the reason it's 600% to 700% increased is that the disease is really not being dealt with. And so what takes place there is the individual has increases their weight gain. They start having problems with their eyes. They start having problems with other organ systems. They end up on cholesterol medication. They end up on heart medication as a result of an underlying problem. And when they start dealing with the underlying cause, then what happens is the medications, they're able to get off all of them as a result of focusing on that disease. But in the 600% to 700% going up is because, again, the disease is getting worse by not focusing on the underlying cause.
And you say that there's a frustration that a lot of your patients have. It's a good frustration, though, right?
What takes place is, on one end, they're having these phenomenal results. They're going, thanks, I've got my life back, I've got control. But the other problem is they get so frustrated that someone else didn't focus on this in the last 10 to 15 years.
Why couldn't they solve it sooner?
Why couldn't they solve this thing sooner? So as a result of that, what we find is that unless someone's really focusing on the custom program, not every diet meets, you know, the basic custom program, the basic diet that is standardized in America doesn't approach their problem. It has to be a program that really focuses on that individual's needs before it changes.
What's a healthy blood sugar level? Because I'm sure a lot of people don't know. I'm not even sure exactly what a healthy level is.
Well, the laboratory says it's 65 to 100, but we find that the sweet spot is between 85 and 100, and that's where you really feel best.
All right. When it's finally solved, when their problems are solved.
Well, it's a great privilege to watch people be empowered to have their lives back. What's really better is they did it themselves. I just coached them in it.
Dr. John Craig, thanks so much for coming on.